of Sekoia, and obviously please do build in some time for questions in that as well.
Of course.
Thank you. So we're recording, so I'll hand over to you, Nehal. Thank you very much.
Great. Thanks very much. And good afternoon, everyone. Thank you very much for having us here. I know it's a long day filled with a lot of good presentations, but at least from what I gathered from the brief discussion, it seems like it's a much needed one. So glad to be presenting here on behalf of Sekoia. Just to introduce myself briefly, I am the head of customer success at Sekoia, and my job is primarily doing all of the training and onboarding of the system. So if and when you do choose to go on with Sekoia, my job is more hand-holding and just making sure that we are looking at your processes, how do you do things, and what's the best way to mirror that into the system, as well as being responsible for training all tiers of the organization until such time as the system goes live in your organization. So Sekoia is currently operating in over 250 care home groups across 4 countries, the UK and Scandinavia, so Denmark, Sweden, Netherlands, and the UK. And within the UK, we are in a lot of different care settings, so nursing homes, residential homes, supported living, dom care, day centers, respite services, children's respite services, basically any kind of a setting that provides care and support at point of care. And the system can be completely tailored and can be completely bespoke to your setting, which is why it molds itself into different kinds of care settings. Broadly speaking, the system is in 2 parts. So what I might refer to as the front end or the app is the bit that sits on a phone or a tablet at point of care. It's what your wider staff group will be interacting with. And it is where they can access all of the information that they need for their service users, and also where they can easily document the care and support that they are providing. And then there is also a back end to the system, which is referred to as the administration. And that is where all of the configuration of the system takes place. So it's mostly handled by a smaller group of people in the organization, maybe management and a couple of people that the management choose to have as super users. And that's where you can, of course, add your own processes, add on new employees, new service users, access reports and such. So what I will be demoing today is the front end of the system, which is the app, and just showing you how the frontline staff would interact with the app at point of care. Everything that you see that I show you is of course our demo environment. So we've just built some examples, but everything that you see can be made completely bespoke to your setting. So if there are certain observation forms or certain tasks that are not relevant to you, please don't be afraid, because it will be completely tailored to your setting and what you need in there. Okay. There are a lot of features and functionality in the system, so I'm not going to cover everything. Of course, we have a short period of time, but if you do wish to deep dive into the system, or just talk specifically about your own processes, then please feel free to reach out to us afterwards, and we'll be more than happy to set up a one-to-one session and run through it in a bit more detail with you. Okay, I'll just share my screen. Hopefully you can see that okay. So this is a tablet view of the front end of the app. Regardless of whichever device you're using, you'll see exactly the same features and functionality. And of course, every individual member of staff will have their own login to get into the app. And once you are logged in, you can see a lot of information on the screen, but I will explain each bit as we go along. So the first and foremost thing that you would be doing is making a selection of the service users that you're working with or whose information you wish to see. Of course, we have our department sort of named after care settings, but yours will be different. It could be floors or wings or however it is that you structure yourself, and you could select an entire department or the entire home, or you could pick and choose certain service users. So I just have a couple of profiles selected here. And when you make that selection, it brings up a task list or a care delivery list of all of the things that you need to be doing to support those service users over a 24-hour period. So the list, it starts from midnight on a day and it goes until midnight the following day. And whatever time in the day that you're logging into, it will show you the tasks that are unhandled and need to be addressed. So as you can see here, I have a couple of residents selected. So I've got John and Gail, and I have some time windows. And of course, those time windows will be completely bespoke to their routine. And if the task has gone past the time window that it's normally meant to be carried out, then it will say that it's overdue and it'll just turn color to red. And if it's within the current time window, then it'll show up in green and say that this is something that's due now. And then everything else that's to follow will be further down in the list. So we'll take a couple of examples. I'll start with Gail's lunch. Now, on the top right-hand corner, we have her name and a picture. You can also put in things like NHS numbers or any form of identification. We also have some shortcuts here for information that you may wish to access quickly. So DNR instructions, allergy information, any known conditions. Then here in the middle of the screen, we have what we refer to as a task description. It's not a lot of detail. It's just meant to have a snapshot of how that support needs to be provided to that service user. And as you can see, you can change colors, you can highlight text, so you can use that rich text formatting. And here below it, we also have some visual instructions. And it's not to say that every single task will have a visual instruction attached to it, but where you think that something might be better explained in a picture or in a video format, then you can add a visual instruction to the task as well. And then here on the right-hand side where it says nutrition, it's actually Gail's nutrition care plan. So again, the idea is to make the right information available in the right context. Again, not necessary that every task will have a care plan attached to it, but where you have that additional information and it would make sense to make it available in the context of the lunch rather than staff having to go and look for that information if they needed it, you can create that tag so that it shows up right there on the page. And finally, what we have here is an observation form. And in this case, it's a food and fluid chart because it's a lunch task. And again, it just means that staff can complete their observations right here on the page without having to go and look for that form. So in order to complete my observation regarding Gail's lunch, I will simply press the register button and I will work my way through the questions that come up on the screen. And again, these forms can be made completely bespoke. We have a list of what we refer to as industry standard forms. They're best practice templates, and we have a list of about 60 forms. They cover audits, risk assessments, routine observations, service management forms as well. And if there are any of those that are relevant to you, we're happy to just pre-populate them for you. But of course, if you want to make changes to those templates based on your own processes, then you're more than welcome to do that or create your own forms from scratch. And we, of course, train you in how to do that as well. Okay, so I'm just going to run through the questions. The first one is what meal it is, and I'll just say lunch, and then what is the food that's been offered. And again, there's quite a lot of options in there, and you can just select the one that is relevant. You also have an option to say other if there was something that wasn't on the list, but again, you can quite easily add to that choice set as well. And then it says what's the meal quantity that's been consumed. And if you do have service users on fluid charts, then you can also enter fluid intake. It's a simple two-step process. So what's the amount of fluid that's been offered and what is the fluid that they've had, and then how much of it has actually been consumed. And finally, towards the end of every observation form, you have a section for additional comments where you can put in anything that may not have been covered in the questions that you wish to record. We also have something known as speech to text function, which means that you can press the microphone button and easily speak into the device, and it will automatically type that comment in for you. So if you do have a longer observation, it comes in quite handy. And then you also have a section to notify a member of staff. And in general practice, you don't really need to notify anybody because everyone will have access to that information in real time anyway. But in instances where there's something important that needs to be highlighted, then you can notify a single member or multiple members of staff in that observation form. Okay, so any additional comments can go in there, any notifications, and finally just pressing the add button to record your observation. So as you can see, the observation has been recorded, and it will have a name and timestamp of who's the person that has made that observation and when, and that's of course linked to your login details, so you're not having to manually put in your name. And again, you can have more than one form attached to a task as well. So this is for someone specifically on a dysphagia diet. If you use the ICB framework and you need to record some information in that context, then you can do that as well. It's not necessary. You can make forms mandatory or optional, again, depending on the context. But if that's something that was relevant to you, then you would also be able to complete any additional forms in there as well. Okay, and once you've recorded your observation, you simply can sign off on the task. And I'll just click here next to where it says lunch, and it will again now name and timestamp it to say that this is the person that has completed this task and when, and it'll be there for everyone to see. So you have that real-time communication as well. Okay, and the same thing goes for any other examples on the list. I might take an activity as an example. So again, you have a description, you might have a behavior care plan attached to it because it's relevant, and you'll have an activity record there. And again, you can just register your observations. So what was the service user's mood like? What activity did they participate in? And did the resident participate? Yes. And then did you take a picture? So again, you can upload pictures, and different forms can be built in different ways, and you can pick and choose how you choose to evidence and how you choose to collect that evidence. Pictures is a great way for activity records, also for things like wound management, body maps and stuff. You can also upload pictures in that context as well. And finally, just making the registration. So easy way just to record the observation and then just to sign off on the task to say that it's something that has been done and everything is name and time stamped in real time. And the time windows will not restrict you from completing something before or after. They're just a general indication of normally this is when this task is carried out. If it is something that takes place before or after, then of course it will carry the live timestamp for when it has been done. There might also be instances where you need to either cancel something or move something depending on the service user's preference or the priority of the day. And you do also have the option to do that. So you have options to move and cancel tasks. Of course, it will be up to management to decide which tasks can be moved and canceled. And if I just press the cancel option, it gives me some preset reasons. So resident isn't at home, they're choosing to cancel, they're unwell, or they're on holiday. Otherwise, you can just put in your own reason as well. So I might say resident's not at home, and I might say John is at an appointment. Again, if I need to notify someone, I can do that. Otherwise, I can simply just cancel the task. It'll show that symbol, which denotes that this is something that has been canceled. And it will say in the history who it's been cancelled by and why. Same thing goes for moving of tasks. If you were to move a task, you could move it to a different day altogether, or you could move it to a different time on the same day and say this is something that perhaps might happen in the afternoon. Again, for moving and cancelling of tasks, it's important to state a reason for why that is the case, and then you can carry out that action. And it says that this task has now been moved. It'll be moved further down to the time that I have moved it to, which is here. So it's just ensuring that everyone is working as a team. You have that real-time communication. Nothing is getting missed or forgotten. Everything that you see on the list is, of course, things that have been pre-planned and are usually on a repetition pattern, whether it's daily or weekly or specific days of the month. But if there are things, sorry, if there are things that happen on the day that haven't been planned for, then you can also create some ad hoc tasks from the device itself. So you can simply create a task and say that actually I did an extra activity, or it was an extra personal care, or something that needs to be followed up. It can be used in one of two ways, of course, to record something that you may have done with the service user, or also to plan for something that needs to be followed up in the evening or tomorrow. So I might say I took John for a walk, and then I can add that task in. Then it's here, and I can sign off on it to say that this is something that I did. Similarly, as I mentioned, you can also create follow-up tasks for something that needs to be followed up in the evening or tomorrow, and it's just, again, making sure nothing gets missed or forgotten. Okay, just a few other bits. We have, of course, a resident portal here. So if I, again, just use John as an example, as you can see, there's lots of tabs running across the top, and each one carries information for John. So the first page is care plans, where you can have all of the care plans available to the staff at point of care. Some of them were tagged to the tasks, but not all of them might be relevant for a task. So you can have a whole other list of care plans available here. And you can also use this request evaluation tab, where staff can leave you feedback on a care plan if they think there's something that needs changing or updating. So it's also making sure everyone is involved in that process. You also have a basic information section. So if you have internal key workers that are assigned, or next of kin information, or just external contacts for that person, then you have access to that information. This is also where you can change the status of a service user. If they were in hospital or had a planned absence, then they would be able to, you would be able to change the status so that it takes away the tasks for that person, and then you can reactivate them when they are back. You have a section for forms. So what you can see here on the list is, of course, all of the observations that have been completed for the person in the last 24 hours, and you can change that time interval as well. And you can look at all of the details. But of course, if there are other forms that need to be completed for the service user, you simply press the add button, and you can look through your forms. You can have them in a list format, or you can have them in folders, and staff can pick the relevant form that needs to be completed, and they can complete it. So say, for example, it was something like a body map. I would simply be able to just make the relevant selection. Say it was a bruise. And if you use a tissue viability grading, and then you have the body map right there. So you can mark the images right there on the screen itself. And again, you can upload a picture if need be. And if you record size of your wounds. And again, any additional comments, you can use the speech to text function. And if somebody needs to be notified, you can notify them, and you can add that observation in. And it's available in real time to everybody, and everyone can see the observation that has been made. And you can also track that over a period of time. We also have health measurements in there. So if you are recording any of these health measurements for the service user, and over a period of time, you can also look at that information in a graph format or in a list. So it allows you to easily identify any trends. You have a fluid module. So if you have individual fluid targets for the service user, it will automatically keep adding up all of the fluid registrations that you've made. And you can look at that again over a longer period of time. It'll tell you for each day what's the amount that's been offered and what's the amount that's been consumed by the service user. Then you have a section for instructions. As I was mentioning, in the context of tasks, you can also have a whole catalog of instructions. And it can have training videos. It can have specific pictures of a service user wanting something done in a specific way. But the idea is, again, just to it's a very good way of pushing best practice and also providing that personalized support. And then, yeah, a couple of other things such as a messaging service, a place to upload files and folders, a place where you can build a library of pictures, and then also a record of everything that is taking place in the system in chronological order. So we also have here at the bottom an overview section where you can look at the same information across multiple service users. So the first page is dashboards. Dashboards is actually an excellent feature that is in the system. It, of course, allows you to see your care delivery and how you're delivering on your care plans, etc., in real time. But you also have the option of being able to build bespoke dashboards. So if I like this one for handovers, this is one that's been built bespoke. And if there are things that you need highlighted at handover, so things like, were there any episodes of challenging behavior? Was there any missed medication, any body maps that were completed, incidents, health and safety concerns, family complaints? This is just, again, a generic example. You can have your own, and you can pick and choose which observation forms that the information is being pulled from and what are the specific things that you need highlighted, and you can build your own bespoke dashboards here as well. You also have an overview of forms that have been completed for all your service users, an overview of fluids across all of your service users. And then you also have a calendar function where you can put things like activities, appointments, and such. Finally, you have a notification section. So this is where you will be notified if someone has specifically notified you about something. There will be a number that pops up, and you can see how many notifications are pending. And you can, of course, see the details of what you are being notified about as well. And then, of course, always remembering to log out before you leave. So that's just a quick sort of snapshot of the app. I'll just take a couple more minutes just to show you the dashboards in the administration part of the system, if that's okay. And I won't go into too much detail, but again, it's just to show you how you can set up those bespoke dashboards and how you can access them as part of the administration page as well.
Thanks, Neha.
Sorry, I'm not, yeah.
It's all right.
There we go.
Jeannie's back. There you go.
Sorry, just responding to something in the chat. I think someone's having some issues seeing the display. Thank you very much, Neha. There is one question. Sorry, let me just scroll up. So Richard Burden's asked, if a member of staff forgets to save the report, I assume that means the task, you were ticking the tasks.
Yeah.
Will it allow you to carry on? And then he said, when you save a report, why does it not tick the box rather than you allowing them to tick it as done?
Yeah, it's a good question. Of course, the observation form, first of all, will be recorded and will be saved regardless of whether someone has remembered to sign off on the task or not. The reason it is a two-step process is because some tasks actually don't have observation forms attached to them. They're simply tasks with a description, and they just need to be signed off when they have been carried out. And certain specific tasks have observation forms attached to them where you complete the observation form and then you just sign off on the task to say that it's something that's done. Also, some tasks will have a couple of observation forms attached to it. So if you just complete one, we don't want the system to automatically assume that the task has been completed. There might be other observation forms to complete as well. So yeah, just two separate processes, but you don't need to worry if you have forgotten to sign off on the task. It will still record the observations that you have made in the observation form, and it will just highlight that the task is outstanding and somebody would be able to pick up on it, because everyone who has that service user selected can see the task list in exactly the same way on their device.
So someone else could just tick to say, yes, that task is complete if that
Exactly.
person just forgotten to do it.
Exactly.
Okay. Could I just ask about Wi-Fi? Does your system enable people to work offline and then sync automatically when they get back into a Wi-Fi area?
No, the system does not work offline. It is, it is supported by Wi-Fi or data packages. So yeah, I think the reason for it is that because it is a real-time system and because everyone is seeing the same information, sometimes when the Wi-Fi is down, there could be instances of things like medication errors because someone has administered it, but it's not synced onto somebody else's device. So we do support quite strongly with, Wi-Fi, doing Wi-Fi surveys and also making recommendations on the data packages and any backup plans that you can have, but we don't allow the system to work offline.
Okay, all right. So that person has to be in an area that's got good Wi-Fi to be able to use to populate the care plans. Or says that. Thank you. Could I just ask another couple of questions? Could you give us some idea of pricing, please? Yeah,
absolutely. We have a very sort of standard pricing model. So we don't have any hardware costs. We work with hardware partners. We can make recommendations on it, but that's entirely the organization's prerogative. We have a one-off implementation cost, which covers all of the training and onboarding and setting up of the system. And that starts at £500 plus VAT. For a digital onboarding. And then, of course, depending on the scale of the organization, we can give you a more specific code. But the standard pricing is £500 plus VAT. And then it runs on a monthly subscription model per month per service user. And that's based on current occupancy. And it is £10 per month per service user. Again, that's subject to negotiation based on scale, but that is the standard rate.
Yeah, okay, that gives us an idea of, it's an indicative costing. So would that be the same for whether someone has got a nursing home or residential home or they're a domiciliary care provider? That pricing is the same, is it?
Yeah, it's exactly the same, and everyone has access to exactly the same suite of functionality. So yeah. Okay,
brilliant. And training was going to be my other question, but you said that's part of the £500 implementation cost. So is that training done virtually or is it face-to-face and the implementation done virtually?
Yeah, I think since COVID and post-COVID, we have been doing most of it virtually, but we are open to also being on site if that's something that is required. And it is a very hands-on process, just lots of stages of kind of building the system, making sure administrators and managers are trained first, and then super users who have a bit more of a detailed training, and then doing the setup of the system, and finally the employees being trained before the system goes live. So, yeah.
Perfect. Okay. In the app that you showed us, does it have any training modules? If someone just forgets how to add a care plan or, the steps involved, is there any sort of training, videos or any training modules as part of the app?
Yeah, we have in the administration, we have a really fantastic tool, which is called Walk Me. So anything that you need to know how to do, it will just basically highlight step by step exactly where you need to click and where you need to go on the screen to get to that part. It does also have a training module. And of course, that's different for administrators, super users, employees. Depending on your role, it will give you a bespoke training for you. And then we also have a great support page, which is a web page, which you can just have alongside the app. And it has all of the training, all of the sort of feature videos. So yeah, anything you need to know on how to do, it'll just walk you through that process as well. Yeah.
Fantastic. Thank you very much, Neha. I'm not seeing any other questions in the chat. So I'm assuming, does anyone have any questions apart from the ones that I've asked? I'm not seeing any more questions coming in, and I appreciate. Sorry, Ranjit has just asked, can you run payroll and invoicing?
No, that's not something that we do. Yeah, it's strictly a digital care planning system, and it's centered around the service users. We are open to, of course, being interoperable and integrating with systems who do that function really well, but we don't do it ourselves.
Yeah, that's fine. Okay, and then I think the last question I think you have to take, Elizabeth asking, does this cover dom care?
Absolutely, yeah. Yeah, we have several customers in domiciliary care, and we cover those processes. Yeah.
All right. Thank you very much, Neha. I'm going to say thank you, and because we're coming up to a break now, so I think we'll let everyone have a break. So thank you very much. Really appreciate the demonstration and for your time.
Thank you very much for having us. And yes, I think someone was just asking the name of the company. So it's Sekoia. And of course, if you do wish to get in touch afterwards, please do so. Thanks a lot.
Okay.
Thank you, Jeannie. Thank you, Dharmesh.
Thanks,
Bye-bye.
Neha.
Cheers. Bye.
As I mentioned, so I've just seen another question sort of coming in just as Neha